Hope you're fine. Mostly patients present to our clinics and hospital with a complaint of unable to clean these areas. Lower front teeth, inside as well as outside, difficult to clean. They are not alone. A lot of patients are suffering from this problem. There are multiple reasons of not cleaning these bottom front teeth from canine to canine. The main reason is angulation of your brush. 90% of the patients brush like this in horizontal direction, that is wrong technique and wrong angulation. Gently brush from downward to upward. Place at gum line and move upward like this, and for inside move back and forth. Second important thing which interfere with proper cleaning of these teeth is our tongue that hinder during the cleaning process. And another important thing is floor of mouth. This area also sometimes at higher level that it's difficult to clean these teeth. The most important factor in deposition of tartar or calculus in these areas is saliva. Saliva contains lot of minerals, especially calcium and phosphate, and that deposit over our teeth to make tartar or calculus, mineralized plaque that is difficult to remove with proper tooth brushing. So we can remove dental plaque, which is basically a soft layer of bacteria over our teeth, but when it will mineralized convert into hard deposit, then the only solution will be professional cleaning by the dentist to remove these hard deposits from our teeth. After that, we can take preventive measures for further stoppage of deposition of these hard deposits on our bottom teeth. What are these various measures to stop or prevent the deposition of tartar, plaque, calculus on our lower teeth? Number one, proper brushing technique. Brush before breakfast is most important thing in removing the dental plaque from these surfaces. Second important thing is extra time. You have to give extra time on these lower teeth to clean them efficiently, gently, and totally to clear all the food residues and plaque remnants from these areas. Like you have to give more 30 seconds to these teeth. If you are unable to properly brush with manual toothbrush, you can switch to electric toothbrush, especially for this area of lower teeth. Interdental brushes are also a very important and easily available aid to remove the food debris and plaque in between the area of our lower teeth. Third important thing is flossing between the teeth. There are different types of floss like string floss, floss pick. Ideally, the recommended times is flossing is once a day, but for these teeth from canine to canine, these lower bottom teeth require flossing after every meal to remove the accumulated food debris, microbes, and any foreign body from these lower teeth. Another important thing is 6 month regular checkup from your dentist. After every 6 months, you have to consult your dentist and you can communicate with your dentist your efforts of toothbrushing, flossing. Sometimes, in spite of all these efforts, you are facing the dental plaque or calculus in your lower teeth. Then your dentist will suggest you to do a professional cleaning by the dentist, that is ultrasonic scaling and polishing. After that, you can take preventive measures at your home. which are more important for future protection of your teeth. Hopefully, this video will be informative to you. If any question related to this, you can ask in the comment box. Thank you.